Before we begin, make sure you have a prone support handy. While it's the clinician's responsibility to ensure that they follow safety protocols, we would just like to share a few safety reminders and tips about this prone support product. Safety starts with reading the IFU. The IFU can be found inside the box and is your go-to resource for setup information, warnings, and essential information. It is important to remember when setting up the prone support device that it is always set up on a flat, rectangular table like this. This provides ample support and stability. We recommend against using it on a neuro-shaped table, as this does not provide enough stability and support. It is important to remember that not all patients are ideal candidates for use with our prone support product. Consider avoiding using this product for patients that have extreme kyphosis, broken skin, or limited mobility. A pre-operative inspection by a trained clinician can help guide clinician decisions. During setup, ensure the patient is already in the prone position and then slide the baseboard under. Once the prone support is in place, do a quick safety check. Ensure that the arms are positioned correctly and that there's no stress on the elbows or shoulders. Ensure that the hands are within the boundary of the baseboard to ensure that the fingers don't get pinched in a collision with the C-arm. Ensure that the patient's head is correctly aligned with the pillow and that the airway is unobstructed. Remember to just check for pressure injury throughout the procedure. If you find that the patient is uncomfortable throughout the procedure, you can remove the face support assembly easily and swap it with the pillow. Once the procedure has been completed, remember to remove the baseboard before moving the patient.